coming back to you, Reed, since I know you spent a lot of time both thinking about and working on these issues, I want to ask you to start answering a question about how we came to be in what seems an incredibly fraught time and moment and situation related to willingness to be vaccinated with this particular vaccine. So obviously there's the whole anti-vaccine hesitation movement. I shouldn't say anti-vax because that's demeaning in a way. But I want to ask you to sort of describe why you think we are where we are before we get to the diagnosis and prescription part.
First, if we sort of look at it generically across the country, you're absolutely right that we've had this movement of people who have been organized against the precepts of vaccination in general. There is a growing distrust across the land in elites, across the board. And we're seeing that distrust of elites in every sector of our society. It extends now into science, so that the word of scientists and the word of trusted officials is no longer accepted as face value by millions of people in the country. Secondly, there is the pernicious effects of social media, where conspiracy theories and all manner of rumor and innuendo with no fact checking becomes the order of the day. And what we find is that there is no longer in America a true north. There's no place that most Americans can turn to have a common conversation on facts. This leads for those who have mischief in their minds, as we have seen through our elections process, and other aspects of our lives. Mischief is now able to be conducted and circulated widely without any checks and balances. Third, the behavior of the President of the United States has been abhorrent. And there is a level of guilt that sits at his feet for having politicized this process that I hope history will judge so harshly as to disavow anyone ever of doing what he has done again. And then finally, you have the specter of people of color who themselves have experienced, with their entire experience in this nation, one of the experiences that leads them to have a distrust of healthcare and distrust of government. And so you add all of those together. The one thing I would just, in the interest of time, just want to underscore that is the premise of the question. This is not an idle observation. This observation is so deeply entrenched that I fear that the disease of distrust and disinformation may be worse in many ways, or it's hard to battle. Not as because it doesn't lead, but it does lead to death, and it does lead to misery and suffering. But the disease of distrust is so significant; it is almost as hard to fight as the virus itself.
Well said. So Ruth, I want to come to you next, and I know Reed too. All of us have thought a lot about these issues in the context of research on human subjects, and of course, we at Hopkins have a particular context and history. So maybe you can speak a little bit to a little bit of the description about how we have come to this moment and the history that informs the kind of distrust that Reed just articulated.
Yeah, thanks, Jeff. I really liked your analysis, Reed, of sort of identifying these four different streams that are obviously all interrelated. It underscores something I think that is very important to recognize, and that is that the groups of people who are concerned and thinking they will not take this vaccine, it's not one group. They're heterogeneous. They have different histories. They have different value systems. They have different epistemic commitments. They believe different things. One strong focus, I think, that we need to have as we think about this is to recognize that because there are different kinds of people, there are the people who were anti-vaxxers, and I will just use that term here because I think it's fine for some people who were anti-vaxxers before this pandemic and before this vaccine. They have a deep distrust of vaccines and similar related technologies. Those people are where they are. There are the people who are, let's call them newly distrustful of this particular vaccine because they're worried about either the pace at which it went or the administration under which it was developed or some combination. And then, and this is the part I think, Jeff, that you were referencing and that Reed, of course, mentioned importantly at the end of his 4 comments, there are people of color and there are communities of poverty who have had a long history, horrible history, as Reed has sort of alluded to, that gives them reasons to distrust not only public health institutions and research in particular, but wider American institutions, politicians, and systems. It's been rigged from the beginning, continues to be rigged against them. So this is the sort of origin of systematic structural injustice, of which structural racism is, the paradigmatic illustration. But it's a rigged system into which poor people and people of color and other sort of oppressed minorities, gender and otherwise, find themselves. And now you've got this vaccine that is being put out there for the African-American community. And I really would rather have Reed speak to this than me, but the African-American community has its own particular legacy with research involving human subjects and with public health institutions generally. You mentioned for us at Hopkins parochially, it's the Henrietta Lacks experience and the experience of her family, which some in the audience may know. Certainly the Tuskegee syphilis study looms large, but there's a term that one of our colleagues has coined of justified distrust. These are communities that are justified in their distrust, and to treat them otherwise, to fail to recognize that they are justified in their distrust is, of course, counterproductive, but also profoundly disrespectful. And so I think it's terribly important that we tease out the different communities of people who are concerned or object or oppose vaccination, and why. There's a different origin story in each of these cases with some overlaps, and the way we respond, and both ethically and programmatically, to these different sources of objection or resistance or hesitancy is very important.